So this is one of our mobility exercises to improve function for plantar fasciitis. You're going to take a ball and you're going to put it underneath your foot, and you're going to roll the center of the foot. A lot of times what you guys are going to want to do is roll where it hurts. So you'll want to roll on the heel. Don't do that. Okay, there's a bunch of nerves there. So when you're rolling, you want to stay to the meat of the midfoot. So she's going to roll the bottom of the foot, and we'll typically go, about a minute here. Okay, and then I'm going to have her roll a minute going across the foot. Okay, and then to stretch those medial fibers of the plantar fascia, she's going to glide her heel back, and then we're going to take that big toe, and she's going to slowly press it towards the ground. Now, a couple things here. Closing angle joint pain or pinching pain here is never allowed. So if you have pinching pain here, you have to back off your range of motion and then just allow this tissue to relax. And as you start to restore function here, then you're going to be able to drop that down. Okay, and I would be holding this position for, a good minute or so. So this is an exercise to strengthen one of the intrinsic muscles of the foot. This is a key muscle that supports the plantar fascia. It controls the rate, helps control the rate at which the foot pronates. So we're going to anchor the band at the heel, and then we're going to grab 2 through 5 here. So I'm going to take the band, patient's going to hold the band, and it's going to lift up the 4 toes. Ideally, she's going to want to keep that big toe down. What she's going to do here is take those 4 toes, spread them and reach them into the band as she presses the band to the floor. We don't want the toes to hammer here. And then I'll have them kind of hold that position, almost like an isometric at the end of that range for about, 3 to 4 seconds, and then slowly come back up again. And then she's going to reach, press the toes into the band. If you're having difficulty doing this or the toes are hammering, ease up on the tension a little bit, so that you can really reach forward and press down. You should feel this in the arch of the foot.
So for this variation of calf raise, we're really trying to get a little bit more out of FHL, get a little bit more big toe activity, and we can also start to do our calf raises with the posterior line of fascia in a lengthened position, because we know that that posterior line goes from FHL all the way around into the calf and up to the top of the head. So what we're gonna do is take a small towel, fold it up, and then I'm gonna place just my big toe on this towel and go up into my calf raise. So what that looks like is I take my towel, I fold it up, I place just my big toe, not the ball of the foot, just the toe itself, onto the towel, and then from here I go up into my calf raise. Now I can do this with the towel just on one side, or I can either use the same towel or use 2 towels to elevate both big toes at the same time.